This presentation synthesizes current research to present the benefits of a properly implemented electronic health record by demonstrating the possible adverse outcomes. In 2004, President Bush called for Americans to have EHR by 2014. This led to a new branch of the Department of Health and Human Services, the Office of the National Coordinator for Health Information Technology. Health IT, especially the EHR, is an inevitable progress. There are many significant benefits to implementing HIT. Dr. William F. Jesse, President and CEO of the Medical Group Management Association, comments in Healthcare IT News that EHRs have the capability to improve safety, workflow, productivity, charge capture, transcription costs, record retrieval, streamline pharmaceutical management, and most importantly, patient satisfaction. In addition to these improvements, EHRs will achieve savings. The American Journal of Medicine predicts a benefit of about $86,000 of savings for each provider. Further, a RAND study published in Health Affairs predicts a potential net savings of about $142 to $371 billion throughout the entire health system. The potential savings of utilizing an EHR makes the costly, expensive implementation worth it. Sometimes the predicted benefits of the EHR are not easily realized. Research by Jan Sidorov shows that IT decreases the amount of time patients are able to spend with their provider due to increased documentation. According to Sidorov, the EHR results in a 17% increase in documentation, while CPOE increases documentation by 98%. To complement this data, Kaiser Permanente studied utilization data after implementation of IT, which led to a decrease in office visits. Sidorov presents the problem of increased documentation time, but stands by the fact that the EHR will still lead to improvements, which is why additional research is necessary in this area. Another study completed by Campbell et al. Shows that 72% of physicians reported more work, aka more documentation, necessary than prior to IT implementation. Another problem with the EHR was a breakdown in communication between physicians and other staff, as well as the patient. However, Campbell, like Sidorov, ultimately believes in the value of IT, as 87% of physicians reported an increase in inefficiency. One particular aspect of the EHR is CPOE. Many experts have studied the effects of CPOE in pediatrics to find that patients wait for the system to process their treatments, and some studies even show an increased mortality rate after implementation of CPOE due to new errors related to the technology. The correlation is unclear, however, because another study showed no effect of CPOE on mortality. Because the effects are unclear, it is necessary to monitor all effects of implementation before ruling out any possible benefits of EHR. In monitoring the effects, there are two main categories of errors that occur after EHR implementation: the processes of entering and retrieving, and the processes associated with communication and coordination. These errors can be prevented through proper implementation of the system. Adequate time must be given to appropriate needs assessment. If the technology isn't necessary, users will likely resent the system and errors will occur. There also must be adequate training so that all users are able to access all areas of the EHR. We believe that IT can and will lead to all of the predicted benefits as well as achieve savings across the healthcare system. However, adverse outcomes are unavoidable if the process of selecting an EHR is not completed. It is essential to have the cooperation of the entire caregiving team and get their ideas and thoughts so that all employees are on board and support the project implementation. Once support is given to the project, it is important to have a specified project plan that will go through each step of assessment and configuration. By carefully going through this process, an organization will recognize the benefits of using IT and will be able to avoid possible adverse outcomes.